Thank you for your interest in my poster presentation, which stems from my MPH thesis, a critical analysis focused on how complementary and integrative health, or CIH, was utilized during the COVID-19 pandemic. My specific aims were to honor diverse research perspectives and to elevate the interests of disempowered and marginalized populations. First, some background information, which I encourage anyone unfamiliar with these topics to pause the video and educate themselves. The references are at the bottom of the slide. I will say that task shifting is defined by the World Health Organization as the rational redistribution of tasks among health workforce teams. It also incorporates the notion of expert patients. I first explored the existing evidence in the Cochrane database of systematic reviews. I then uploaded 231 articles into Covidence from PubMed. Inclusion terms were COVID-19, yoga, mind-body, public health, commentary, protocols. Relevant date range was from March 20th to April 11th. Exclusion terms were case studies, study protocols, and any article that was unavailable, ongoing, or completely stopped by COVID. Also, any article that would break the ongoing academic boycott of apartheid was excluded. From that initial pool, we eventually landed on 92 articles that were then further sorted for analysis. The literature highlighted that the demand for CIH spiked during the pandemic, as determined by Google Analytics, which points to a simultaneous mental health crisis. Although CIH practitioners are clear themselves about the mind and the body being connected, quite a bit of the literature continues to separate the body and the mind. For example, yoga is sometimes considered just a physical exercise. In general, there was too often a lack of definition or incongruity with the official mesh terms. The bulk of the literature described the move online. However, there's currently a lack of understanding about the long-term impact of so much technology use. Concerns about technology's environmental impact was not mentioned. Concerns that were mentioned included technology's contribution to the state of depersonalization. Perhaps this is what we're calling Zoom fatigue. Another concern was the potential for leaving people and communities behind, which would only heighten existing health disparities. Another major shift highlighted by the literature was how much healthcare workers themselves became recipients of CIH. The research pointed out when CIH is an important tool and when organizational and society change needs to happen instead. Relatedly, a few researchers discussed critical race theory and the impact of George Floyd's death on many people. The strongest examples of task shifting did appear through protocols for mental health and back pain. And yet this is another example of how the body and the mind are being treated separately. I believe that the expanded inclusion of CIH simply requires policy efforts focused on supervision, as this is a foundational component to task shifting. CIH researchers in general need to provide more clarity about how their work aligns to policy and with the official mesh terms, or those terms need to be changed. Providing more detail about the CIH professionals involved with research could assist with replicability and highlight the work that is being done to work with more diverse practitioners and populations. Researchers in the United States have an opportunity to incorporate traditional practices by collaborating with Indigenous practitioners and communities. But this body of literature did not provide a single example of this happening. In sum, this critical analysis provides considerations for researchers that may help strengthen the evidence base and for policymakers that may enable tax shifting during future emergencies. Thank you to the traditional knowledge keepers where I live, work, and play, the Piscataway people, and to the key informants I worked with. Thank you to all of you for your kind attention. I look forward to hearing any questions or comments that you may have.